Hi everyone. Firstly, thank you all for joining our webinar today that will be centered around how to communicate with your employees in a crisis and the use of mobile technology. My name is Liam Doyle, Product Specialist here at StaffConnect, and today I'll be discussing with you how crisis communications have progressed in recent years, new threats that have emerged, and how to incorporate this into your comms planning. I'll then move on to how mobile technology is helping solve the issues that arise during these times before moving on to some real examples of crisis communications where we will be joined by Helena Reeves, Director of Helena Reeves Associates and former Director of Communications and Organizational Development at CHP, who will be taking us through her experience of crisis communications. So when the norm is interrupted and crisis ensues, it has always been imperative to contact those who you care for, whether this be family, friends, or colleagues, making sure that the correct information is disseminated and all involved or potentially impacted by events are aware of what is going on and the necessary next steps. A crisis is an event outside the norm, not scheduled or expected, but also a time where communications are crucial. It is unfortunate, although apparent, that the number of national and global crises are escalating that range vastly in scope. From natural disasters such as hurricanes or fires, terrorist attacks, or the ever more concerning nature of cyber attacks, it is now clear that the notion of normal is becoming far harder to discern. As 24-hour news coverage shows us a growing number of harrowing events, it is in these times that the lines of communication, your strategy, have to be at their clearest. However, it is that in these times, the first casualty is usually the truth. Why is this? Well, there are several reasons. Firstly, whenever there's an information void, when uncertainty is spreading, it can very easily be the case that rumors and hearsay become labeled as fact or official advice. Or perhaps it may be the case that a cyber attack or natural disaster has disabled your IT's infrastructure, rendering the organization and workforce unable to exchange accurate information, leaving employees to speculate, something that can become much more dangerous if, as mentioned, it is mistaken for official information. Of course, we now live in a new modern age of social media, something that can have a greatly positive impact for company communications, a great way to disseminate news. However, during times of crisis, if this tool is not appropriately harnessed, it is very easy to communicate inaccurate, misleading, and unauthenticated guidance to employees. However, when expectations are set and the right controls and applications are in place, you'll have the ability to leverage these new tools to facilitate your organization's ability to provide much needed guidance and support to employees. This, of course, is vital for your non-desk workers, those out in the field who are often very limited in their ability to communicate with the organization. So what is the solution? Well, one that goes a long way in solving this is a mobile internal communications platform, which can help an organization and its workforce respond effectively to any given crisis. This solution should consist of three necessary parts that are intrinsically linked: an interactive app, an intuitive management console, and a thorough and efficient success program. Of course, the goal of this is to unite the entire workforce, from those in the field to those in the boardroom, a solution that can reach all employees regardless of their location and role. So a platform that has these capabilities then has the ability has the ability to significantly influence a company's communication strategy during a crisis. It enables employees to find documents on safety procedures directly from their own smartphones, as well as giving them direct access to a company directory so that they can connect directly with crisis management colleagues. Further to this, a mobile solution ensures that the company can get important information, important messages in front of employees immediately and directly via the push notifications functionality on their devices. As employees are each assigned a location and department, you also have the ability to instantly segment staff into those who are directly affected by the crisis and those concerned for colleagues, allowing them to provide specific guidance or information to each group. So the key element here is that a mobile solution enables organizations to communicate before and during a crisis, as well as after the events have unfolded. A documents library to house important and key information, preparing your employees on what to do in times of crisis. The push notifications, news feeds, and chat feature are then key during times of crisis, with post-crisis comms disseminated in a similar way. This tool enables your employees to understand what is going on within the organization or outside of it via an official channel, ensuring they have the knowledge on how to act accordingly. So to give you a better understanding, what I'll now do is highlight two real-life examples of mobile technology being utilized as part of crisis comms. The first is the USA-based YMCA. One of their groups were using a mobile app to keep their staff updated when various hurricane situations were developing that would severely impact the southern states. The YMCA crisis team used the app during Hurricane Irma to keep their employees up to date as the storm unfolded. Staff were able to use the app to report if and when the disruption was going to keep them from attending work, meaning that they could discuss logistics and alternatives with their managers. The mobile technology they were using also helped with car share arrangements and various other forms of colleague cooperation, including redistributing work and sending well wishes to co-workers. In summary, the app allowed YMCA Greater Charlotte to check on the safety of colleagues, share important crisis information documents, and allowed continuous, uninterrupted communications during the hurricane, which meant that normal business could continue as usual. So our second example of mobile technology being used to execute crisis comms comes from London-based Community Health Partnerships, CHP, who used mobile technology to inform and advise employees of a terrorist situation that was developing in Westminster. Unfortunately, as we know, that situation turned into a devastating attack. However, today we are joined by Helena Reeves, Director at Helena Reeves Associates, who helped implement StaffConnect at CHP. What I'll do now is pass you over to Helena, who can take you through how they use mobile technology during the Westminster attack. Helena.
Lovely, thanks, Liam. And I hope everybody can hear me all right, and we've switched that over well. So just a little bit of background from me to begin with, really. I've been in NHS communications, and I believe we've got some NHS comms colleagues on the webinar, so welcome. And as I said, I've been at NHS comms for about 24 years, a bit scary, really. But I think one of the really good things the NHS can do is it's really, really good at managing one crisis of a kind or another. And if I've got any colleagues from Northwest Ambulance or from London Ambulance, well, to be honest with you guys, I'm in awe, and you are to be honoured for your work during the Manchester Arena tragedy, and obviously the too many terrorist incidents that are happening in London or have happened, and of course the receiving hospital staff, because if you're a comms colleague at one of those, you jolly well feel the impact for many days and times after that. We just have to take Salisbury and how well those guys have dealt with the Russian incident. But there are also other human disasters that cause equal attention and impact. Public health issues, for example, can't fail to have missed the recent breast screening incident, where we know up to 75 women may have suffered harm as a result, and don't think that story is necessarily ended yet. Or just for me personally, going back a few years to pandemic flu, at the time I was working at Surrey Primary Care Trust, and for my non-NHS colleagues on the call today, these organisations don't exist anymore, but we were the lead health authority right across Surrey, and so for pandemic flu I was Gold Communications. And I spent a lot of my time at Mount Brown, the police headquarters at Guildford, working with Surrey Police, obviously our own public health team, the councils, of which there were 12, including Surrey County Council and the local districts and boroughs, and the other agencies to coordinate Surrey's response. I have to say, it felt pretty much as a nightmare at the time. We had a near miss because we nearly had the first confirmed case, and my team would tell you that, you know, we were very, very quickly trying to get together about how we were going to manage that. What I know for sure is that it would have been a lot better with the technology that we now have at our hands. And certainly getting messages out to multiple staff groups would have been much, much easier. And as Liam said earlier, I used the StaffConnect app at Community Health Partnerships during the Westminster Bridge attack. Now, luckily for us, it wasn't an attack directly on the company, and CHP is just by the by, is a national company which is wholly owned by the Secretary of State for Health, and it has many staff that are out on the road and not tied to desks. And my NHS comms colleagues would know that we generally have a protocol in the NHS, which is you always inform your staff before anybody else, but we also have a duty of care to them. And during times of crisis, as Liam highlighted earlier, it's very easy to either leave staff behind because you're dealing with the media impact, or indeed you might just be dealing with what's going on in your very hospital. And it's very easy to some staff groups get left out, or some get information before others. For that Westminster Bridge attack, I had no way of knowing who may or may not have been in the area. Our head office was in London at the time. For colleagues who know, down at Skipton House, Elephant and Castle. It's not that far from Westminster, it's walking distance. And from Richmond House, which is the Department of Health's main base. And we have a lot of people going to and from Richmond House. But you can see from the screenshot that I used the app to inform staff. And what I haven't been able to show you, because you know, these things are of the minute, was sending push notifications out to ask if anybody was in the area, and to let us know that they were safe by contacting their line manager. And you can see that we kept people informed during that time, and as the tube station had remained closed for a couple of days after the incident had actually closed. So without going into all the detail, and I just wanted to be really clear with people, this was using the app before we'd actually formally launched it into the organisation. So it was very much less strategic, much more, I've got this, I'm going to use it. And it did work very well. It helped, I think, introduce, you know, let's be face it, what good comms person ever doesn't use a crisis to their, you know, to best effect. It did help us smooth the entry into the organisation, because people could see the value of it. Anyway, Liam, I hope that's enough background from me, but I understand you might have some questions.
Just turn my mic back on. Yes, I do. Thank you very much, Elena. That was amazing in terms of background. I guess, what would you say is the biggest benefit of a comms channel that has the ability to reach all of your employees, you know, whether they are desk or non-desk based?
So I think in a way it's hard to quantify exactly, but I think it is precise. The answer is almost in the question, really. It is being able to do that, I think, first and foremost for me in real time. So you're not relying on somebody to wait till they've read an email. For me, the real beauty of using an app is that push notification, so that you can push it right in front of somebody's face. This is happening, this is going on. And on front of the app itself, which I don't have a screenshot of this particularly for you, but there's a rolling sort of excuse me, like a teletext, so that you can a rolling teletext, so that you can have that message right up front for people as well. So I think real time for me is massive. Being able to push it right in front of somebody's nose, and that kind of updated, literally you can change that as often as you like, as many times as you like, and you know that you've reached out. And okay, maybe somebody is busy in a meeting, or they're on a bus, or but you know, and if they're on the tube, they'll pick it up as soon as they get out. But it is as real time as you're going to get. And so I think grabbing everybody's attention right at the beginning of something to alert them, I think is just really precious for, you know, every comms professional.
No, definitely. And if you didn't have access to mobile technology, I guess the push notifications, the ticker tape feature, how would you have tried to communicate with them?
It would have been by standard email. It wouldn't have been any other way. We could have got, I suppose, some of the line managers to check where their staff were by checking diaries, but it would have been a time, you know, to see where people were, to see if they were in the area, to then try and get hold of people. But it would have been a very much longer, more time-consuming process. And I'll be really honest with you, Liam. This wasn't done in a very planned way. We obviously did better planning later, but it would have taken a lot longer. And I know from colleagues who suffered badly during the cyber attack with the oh gosh, I can't remember the name of the virus now. Was it the Wanna something anyway virus? Who maybe hadn't been able to update their systems. They were relying back on paper. So I think the time lag is really, really critical. And therefore the impact is always greater.
No, definitely. Just another question, I guess, what was the feedback from your employees about the communications they received during essentially the attacks?
So I think people valued it. I think particularly they valued the fact that we valued them. We valued them enough to worry about their safety. They hadn't really, I think, experienced that particularly, and obviously not via technology before. I think the major feedback for us really was that we need to get better at doing this, and how could we, I think, how can we plan for this in a more constructive way going forward? And so what we did do is take some of that learning, and I started to have conversations with my other colleague executive directors about how we might begin to ensure that, you know, more formal systems were in place, particularly for supporting staff.
Yeah. Brilliant. Well, thank you so much for that, Helena. Really, really appreciate it. A fascinating insight, really, to crisis comms as well, but specifically in the NHS, it's really is fascinating. What I'll do now is conclude the webinar, and then what we'll do is open up to a Q&A with all of our attendees today, where you'll be able to ask either Helena or myself any questions that you might have. But so an enterprise compliant mobile communication solution, you know, it's not only a fast and effective, but also auditable and secure, you know, helping to mitigate any worries about the transmission of confidential data over unknown servers. You know, of course, these types of platforms and solutions, they cannot directly fight or defeat terrorist attacks, prevent natural disasters from happening, or solve the issues of cybercrime. However, it can enable quick, effective, targeted, and continuous communications in a crisis. When the truth is vulnerable to being misunderstood or or hearsay is interpreted as fact, especially in times as precarious as those mentioned, you must ensure that from an organizational viewpoint, your communication strategy is clear for both administrators and employees. Embedding a mobile solution into your communication channel allows you to communicate with your entire organization instantly, whether they may be non-desk workers or based in the office. In times of crisis, communications are crucial, and having a mobile solution ensures that these channels remain open. So that is pretty much the webinar. As I said, if you do have any questions for either Helena or myself, there should be a section in your webinar control panel where you'll be able to ask them. Let's see. Oh, went too far. Something's going on my screen. 1 second. So a question here. I think this would probably be best for you, Helena. What would be your advice on integrating your internal crisis communications into your overall comm strategy?
Oh, really good question. I'd do it, I think is the answer. It would be madness not to. I think the more you can get prepared, the more you can work with your executive team, the more you can get them on board, then the better prepared you will be. Making sure your team understand what the plan is, and even just having your logistics where everybody knows where they are and you practice regularly and you check it regularly is really, really vital. But I think having the advantage of even greater technology today is use it. I mean, do it, use it. My understanding since I've implemented the app at CHP is that the product that Liam is talking about is even better, and that more targeted engagement is possible than we had in the early days when I first implemented it. So I think you can make sure that you could set up all of that well in advance, so that you are, you're just ready to rock and roll. I just think it's bananas not to put the two together.
No, to be honest, I would have to agree with you there. It would just clearly make sense to put the two together. I'm not sure if there are any more questions, so what I'll do is I'll wrap it up there. Firstly, I would just like to say a massive thank you to Helena. Thank you so much for joining us today. It was a real fascinating.
Very welcome.
To really understand kind of what was kind of going on, and especially going on within the comms crisis teams within the NHS, and how I guess you use mobile technology. So thank you so much. All my details are on screen right now, so if you do have any questions for myself, want to know a bit more about mobile technology, StaffConnect, please do get in touch with me. We can get those conversations started. I'll be sending all of you follow-up emails with the recordings as well, so you'll be able to catch up everything there. Otherwise, thank you, Helena, so much for joining us once again, and thank you everyone else.
Very welcome.
Thanks. Bye.
Thanks, Liam. Bye-bye.